Welcome to Her Health First Wellness Collective, where Black women come first. We're here to educate, advocate, and empower you to take charge of your health because your well being is not optional, it's essential. On today's episode, we're talking about one of the hardest parts of the journey so far, a reaction to the chemo meds. We're going to talk about that moment, what it felt like, and how she found the strength to keep going. So grab your tea, take a breath, and lean in close. Hey y'all, and welcome back to Her Health First Wellness Collective. I'm Tracy, and of course, you know our VIP guest here, Tamisha.
Hi, everyone.
All right, so I know things look a little different, and they'll probably be looking a little different from here on out because I know y'all are sick of us and these technical difficulties. We're sick of it too. So we got us a little studio, and this is what we're gonna do. We're gonna do our videos right here, okay? So I did love being able to do it while we're at chemo, kind of, in the moment, but technical difficulties. So, so let's start off like we normally do. How many thumbs today?
Today, 2 thumbs.
2 thumbs up.
I don't have nothing going on today.
I like it. I like it. 2 thumbs up. All right. So for those of you that have been here, you already know Tamisha, you know her journey, you know where she started, and you know where she is. But for the people who haven't been here, or for the people who may be seeing us for the first time, would you mind just telling us a little bit about who you are and who you were before your diagnosis?
Oh, yeah. So, hi. Once again, my name is Tamisha. So, who I was before the diagnosis, I'm pretty much the same. Goofy, bubbly, want to laugh. I won't say I don't take things seriously. I just probably react like to things differently than other people would normally react to.
Yeah.
I'm just here, a mom,
Yeah.
a sister, a daughter, a cousin, an aunt, I'm all of those things. And that's pretty much about me. I have a 5-year-old daughter. I was diagnosed with breast cancer actually 4 days after my birthday. And it was 8 days into 2025 that I got diagnosed. I think if I'm not mistaken, the 8th was on a Sunday. If I'm not mistaken, I could be wrong.
Let me see.
I'm not sure because I think I had my appointment on the 3rd. No, the 8th wasn't on a Sunday. No,
The 8th was a Wednesday.
it's the Wednesday.
Because you had your biopsy on the 3rd, which was that Friday.
Friday.
The day before your birthday.
Day before my birthday.
Yeah.
So on a Wednesday, that's when I found out I had cancer. And the first thing, it came through my chart. And I looked at it. I knew that I had it from reading it. And I just was, going to the bathroom. I just threw, my phone on my sister's bed. I was like, look at this. Because I didn't even know, I really didn't know what to say. She looked at it and she was like, oh, yeah, she's looking like, oh, yeah, you have cancer. And then she was like, you want to call mom and dad? And, my first reaction was like, no, I don't want to call mom and dad, because you don't want to, because it was at nighttime when I found out too. And then my doctor called me. She was like, I don't know if you got the results, but you have cancer. She just broke everything down. And I was writing stuff as she was going along. And I'm still like, still don't believe, like, dang, I really have cancer. Then we had to call my mom. My mom didn't really, take it good. And it was kind of, hard hearing, my mom not taking it good.
Right.
Then I think we told my niece, she took it, she took it well, I guess I would say. Or she didn't show to me that she was, taking it hard. Now, my oldest niece, no, she didn't take it good at all. She cried. I was like, oh, man. And, some of my friends cried too, but mostly I try to break the news through text message because I think it was just a little easier instead of calling, on the phone to be like, oh, hi, how you doing? I have didn't want to really sound like that because it's kind of like a, awkward conversation. I kind of felt. But that is my story.
Yeah. Yeah, that day was, I don't like it. I don't like it. What symptoms or what led you to go to the doctor?
To be honest, I will never forget. It was just one day. This is back in April of 2024. I was just laying in the bed, and then like my right breast was hurting. Now, usually it gets a little sensitive, when it's the time of the month, but this was just like a different type of sensitive. Then I try to lay down, I rolled over, I try to sleep it off. Then when I woke up, it's like I could not lift up my arm. I was in excruciating pains. I was literally in tears. Like I couldn't open the door with that hand. It was just the worst feeling ever, not knowing what's going on. I'm like, but it was only on the right side. So I go to the hospital, get there, ended up going to the emergency room, and then they just, I don't know, it just wasn't a good experience. Right. The experience was just so traumatizing. They were like, I asked them, did I have an abscess? They said no. Did I have a cyst? They said no. They did an ultrasound. The ultrasound had like 8 to 10 different areas that were problems. And it was just so like confusing. Then they put that I had discharge. Then they said they was gonna drain my breast, which I didn't have any fluid. So I was like, like I didn't even know what they were talking about. I didn't even know that they said they drained it. It's not until I asked, can I take a shower? So what ended up happening, I had to stay in the hospital for 3 days because I ended up being stroke alert because they just in it, and I just had a feeling, and it just took my heart rate just went up. It would not go down. It was like 132, and it would not elevate. It was just like, because I just knew what they were doing. I just knew something wasn't right. Like I was like, this don't, like, what fluid are you guys talking about? Like I don't have fluid. I never had fluid. Only thing I had was the inflammation and the swelling of the breast. Unable to raise my arm, and my lymph node under my right arm. It was a lymph node that was real big. I could feel it, and I did tell that it was swollen. So that they were correct on. So then eventually I had to, go to a breast specialist. Went to a breast specialist. It took some time to get in, but I finally went in. My breast specialist was Marley White, and she was so sweet. She was just like, well, we're gonna do some tests. And she was like, I don't, she was like, at first she was gonna give me steroids, and she was like, no, I don't want to give you steroids, and just in case, that's not the issue. So she was like, oh, you gotta go get the whole 9 yards, mammogram, ultrasound. They had difficulties with the ultrasound and mammogram because they said my breasts are so dense. So then I had to go to MRIs. Then they didn't like, so then because they was comparing the two notes from the hospital to what they're seeing, then they had to do their comparison to what they're seeing. It was like three different things. So then they said, no, we're going to do it again. So they didn't want a biopsy. So I ended up getting three biopsy on the right side and one on the left. Long story short, it was two like cancerous on the right, one benign, and then benign on the left. And then for me, mine started in my ducts. So I didn't have the typical like symptoms where you feel like all the lumps. It was just like real sore. It just was excruciating pain. I wouldn't wish it on anyone. Like seriously, it was just like so uncomfortable. And then my right is my dominant hand, so a lot of things I would limit to. I have to use this hand trying to do this, and it's just wasn't fun. I couldn't work anymore. Just had to go through so much. And my sister and the rest of my family had to kind of like pick up the slack work because I couldn't do certain things. I can't lift this. I can lift with my left hand, but it's not as strong as my right for certain things. And and that's my story of how we got here.
Yeah. All right, so let's talk about the chemo journey, and what we're going to talk about today is the reaction. She had an allergic reaction to one of her meds. Tomorrow, well, it'll be 2 weeks, about 2 treatments ago. So this last treatment went fine. The one before that at the very end. And when I say at the very end, there was literally this much fluid left in the bag. And she started to have a reaction. So we're going to go into that. So first question is, can you walk us through your chemo treatment? How many rounds have you had? How often? And do you remember what meds you were given?
Well, I don't know. I do not know the names of the meds like that. That definitely would be my sister. She remember them. I think one is Taxol, and that's probably the only one that I know. I had it. So in the beginning, I would go bi-weekly, and I had 4 rounds bi-weekly. Then after the bi-weekly, then I went to weekly, which was 12 rounds. Now Wednesday would be my last round.
So by the time y'all are seeing
this
this
video,
it will be her last round.
it'll be my
very last round of chemo.
Okay, so that'll be the 12th round.
Yeah.
Yeah.
Okay. So yeah, you got Taxol, you got Cytoxin, carboplatin, and geez, what's the other one? It's one more. I can't remember the other one, but I'll look it up and I'll put in the video what they are. And then also every 6 weeks she gets Keytruda, which is immunotherapy. So it's supposed to help boost everything within the body. She gets that every 6 weeks. And then even though tomorrow's going to be her last chemo session, she still has to go back every 6 weeks for the immunotherapy to make it a complete year. But chemo will be done. Okay. So you had a strong reaction to one of your chemo meds. Can you describe what happened physically and emotionally?
Yeah, so physically, at first I just started coughing, but I just thought it was just like a dry cough because I'd been coughing, on and off, throughout chemo. So I'm thinking it's just a cough. So I coughed and then I realized that my hands started itching, but I thought my hands were itching because it was dry. So I put some ointment on my hand and I touched my lip. I touched my lip and I felt my lip like, it just felt funny. I'm like this. Then I was like, my lip is tingling. So my sister's like, press the button. Press the button. And I'm like, oh no, I could just wait till I get home and get some Benadryl. And she's like, press the button. So I didn't press the button. So she ended up pressing the button.
Mm-hmm.
They came in there like, oh my gosh, they came in there so quick, like so fast. It was like a snap of a finger.
Yeah.
And I'm just looking around. It was like, are you okay? And I'm like, yeah, my lips is tingling, but as I'm talking, my voice became hoarse.
Mm-hmm.
So you know me, I don't know. I don't know. I didn't know that was part. I'm just thinking my voice is getting hoarse is just part of the reaction, not knowing that my throat was closing.
Mm-hmm.
But I didn't really panic or anything. I just see them moving because it was just so much going on. I don't even think I had time to panic because they were like, "Oh, get the pharmacy on the phone." The pharmacy's like, "How much does she weigh? How tall is she? When was her last dose?" And it was just so much going on. Then they was like, "Oh, we got to get an EpiPen." Like I stuck with an EpiPen. Then they were like, "Dose me up with the 2 doses of Benadryl." And I'm just like looking around. Then they're checking my chest to make sure that I'm breathing. Like, how's my breathing? Then I heard the word ER.
Mm-hmm.
Oh my gosh. Now, mind you, my heart rate was already a little elevated. If I heard the word ER, it just went like it just something about the ER just it just goes up. Yeah. And it was like, oh, her heart rate is high, and then the pharmacy like was it high before? Then it was like, no, it was high before. We're gonna try to get it back elevated, but it was kind of, it went down a little bit slowly, but for surely. And they ended up having to stay till a whole hour because they said they had to make sure that the reaction didn't repeat itself after the medication wore off. Right. So we didn't leave there till like 9:15, and it was just like, OMG, like really, like we closed the place down. We did. But you know what? The nurses that were there, they were awesome. Yes. It was 3 of them. It was Angel and Emma and one. We don't know how to pronounce her name, how to say her name. Yeah. But she was always also the threesome. Definitely was there. They were working in unison. They were just moving and they made sure I was good. They kept checking on me. You okay? And I know it's probably like they were probably nervous too. I know my sister was nervous. I don't even know if I was nervous. I think I was just like stuck a little bit because all the medication that they were sticking me with. I think I couldn't really react. Yeah. But when she told me like all the symptoms that I had. Oh, I forgot to tell you, my left side of my face was swelling. Your sister, your left side of your face is swelling. I was like, oh my gosh. I'm like, no, this can't be. And then we were literally was almost finished, like literally down to the last. It was like this much left. And I never had a reaction before or none, nothing like that. But that was like, then the next day I was fine. My nurse Rebecca called me like, you okay? We heard you had a reaction. You okay? And then also I forgot to mention they text my actual oncologist, Dr. Rich. She's such a sweetheart. She is. She responded, and it was like between the hours of 7:30 probably all the way to the time for me to go home. She responded. She was like, just let's just try to keep her here before we send her to the ER. Like she just was, because she knew she knew I was gonna overcome it. So she had faith in me. She knew that I was. So, and I appreciate her just for her to respond, because she was off of work and she wasn't even a nurse on call. So it was just like, I was just so like thankful, I was just smiling, because it was like, it felt good to have like people that really care about you, that really, really care about you. Like when I tell you, I just feel so much like love and energy from them. It just makes my journey, even better, because you get the love from your friends and family, but these are complete strangers, and they see, they can see 152 different, patients in a day, but they remember everything you tell them. They remember you. They don't think of, you're not just like oh, that's just Tamisha coming in. No, they remember, oh, that's Tamisha coming in, and she did this and she did that. And, they remember, and I love that. Yeah, they're awesome. They're really, really awesome. And I will say, from my point of view, like just thinking back about it now, like, my eyes are starting to tear up a little bit, only because, and me and two of the nurses, we talked about it. And being a nurse and know what could happen, your nerves are already shot. If you're a nurse and this is a patient going south. Now, your nurse and the patient going south is your family member, whole nother set of apples, but I knew that already this was not the time for me to spaz out. But on the inside, oh, because when she said her hands were itching at first, I was like, okay, but then she was like, my lips are swelling. I was like, your lips are swelling. She was like, yeah, they feel a little, yeah. I'm like, push the button and let the nurse know. Nah, I'm gonna just wait till I get home and take a Benadryl. No, the hell you not. I gotta push this button, honey, because I already knew. So I pushed the button and I got out the way. The nurses came in and I was like, hey, she's having an allergic reaction. And then, like she said, they just got to moving. One person started doing vitals. One person called the pharmacist. One person went and pulled meds. They were on it. Boom, 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 boom. Well, they called a rapid response, and then they called the pharmacist also. But they moved so quickly, and thank God for them. And then so I'm standing on the outside, and she's sitting there. She's got all these people around her, and I keep being like, okay, I'm trying to make sure that I could see her, make sure she could see me, and be like, you okay, they got you. So for me, once everything was over, and she did not lie when she said they gave her the meds, okay, because she had epi. She had epi to fight the reaction. She had a double dose of Benadryl, so that's 50 milligrams of Benadryl. After the epi, she started feeling nauseous, because that's one of the side effects of epi. Epi speeds everything up. So she got nauseous from that. They gave her compazine on top of all of that. So she was just, after a while, she was zonked. She closed her eye. You see those eyes just closing, and I'm like, good. At least she's comfortable enough to get some rest. So afterwards, while she was sleeping, one of the nurses was talking to me, and she said, wow, you guys were so calm during that. And I told her, I can speak for me. I was calm on the outside. On the inside, baby, I was going crazy. And, afterwards, once I knew that she was okay, her vitals were somewhat back to normal. Her heart rate was coming down, blood pressure was coming down, her breathing was fine. I went to the bathroom and I had to go collect myself, because all those emotions that I had that I was holding in, I was like, I gotta let them out somewhere. So I had to go to the bathroom to collect myself, because it's scary. It's scary having an allergic reaction like that. And then, at the point when they asked her something and her voice was hoarse, I was like, her voice is hoarse. Like, hey. So, it just, then that put a new level of fear on it for me. Because now we getting to the point where your voice is hoarse. Now, wait a minute. Okay, hold on. We need to back this up. So I am so very thoroughly grateful to those three nurses that night. So very grateful. And don't worry, we tell them every chance we get. We let them know too. We are so grateful for them. Oh, so very grateful. So what it says, so the next question is, did a medical team anticipate that reaction?
and how did they respond once you told them what was happening? But before you answer that, so you said that you were almost done. So to give you an idea, she started off with about 8.5 ounces of fluid is what she started off with. She had a tablespoon, 2 tablespoons left. So yeah, she started off, 30, yeah. So she had 2 tablespoons left. She started off with an 8-ounce cup. She was down to 2 tablespoons. And that's when she had the reaction. So just to give you an idea of how far along we were going to be done in the next, I think, what did Emma say, 7 minutes?
Yeah, about 7.
7 more minutes. And it goes over an hour. So that tells you how far into the process we were. So do you feel like the medical team anticipated you having a reaction?
I think Angel.
Yeah.
Angel did, because she kept, as I'm thinking about it, when I kept coughing, she kept saying, "Are you okay?" She kept saying, "Are you sure?" She kept saying, "Any other symptoms?" And I'm like, "No, just a cough."
Yeah.
And she was like, "Let me know." And then I'll cough again. She was like, "Any other symptoms?"
She
I'm
did,
like,
yeah.
"No." I'm
Yeah.
like, "No other symptoms."
Yeah.
And she was just like, "Okay."
Yeah.
And she kept coming. She came like
She did.
3 or 4 times. So I think she kind of anticipated. I know with one of the treatments, it builds up in your system, and then as the more you get it, then the more likely or the greater chances you are of getting your reaction.
That's the carboplatin.
So that's the carboplatin. I thought it was a Taxol. So I maybe, I don't be knowing the names of the medication. I really don't.
So yeah, I will say afterwards also, Angel said that's why she kept coming. She said because she kept hearing the cough, and the cough sounded like it increased. And it sounded like it did to me too, but I was thinking, she's getting all this fluid, so maybe it's just a little, a little something, you gotta clear it up. But then when she got to talking about them lips swelling and tingling, okay?
My lips are too big to be swelling. Okay? I don't need to get any bigger. They're big enough.
Oh gosh. Jeez. So was this reaction something that made you want to stop treatment? Was this something that made you like, man, I don't want to do this no more?
Not necessarily stop treatment, because I know they can like tweak the medication. So I know they had to do it before.
Yeah.
So I know that they could tweak the medication and give me like a lower dosage. And in order for me to be able to take the medication. So no, I didn't want to stop treatment. Then I was already 2 more left,
Yeah.
So it was like, what was I gonna do? Wait for them to give me another medication, which I wouldn't have known what if I would have had a reaction to that medication. So I was just like, no, we can continue, because that was one of the questions Dr. Riss asked me, do I want to continue? And I'm like, yeah, just go ahead. I'm like, what do you think? And she was like, yeah, let me just work my magic. And she worked her magic, and I did it last week, and I didn't have any reaction. I was totally fine.
Yeah, she lowered the dose. Plus, the nurse ran it for twice as long. So instead of running it over 1 hour, the nurse ran it over 2 hours, and the dose was lower. So definitely. So did the reaction affect your day-to-day life in any way?
Well, just for that moment, not afterwards. I didn't have any other symptoms afterward. The same thing with the fingers, my nails, the usual stuff, nauseous here and there. Just the typical, nothing, anything else different. Like, I didn't get no rash or anything.
Yeah.
Additional pain.
Okay. So did that reaction change the way you looked at your journey overall?
Probably would say it was, as far as like probably the scariest, probably I would say, moment. I think that was more scary than them putting in the port and me getting starting chemo, to be honest, because it seemed like the symptoms were coming one by one, like, and I was like, well, dang, like, I'm gonna keep getting this symptom, that symptom, like how many symptoms I was gonna have, so that I would say yes.
Yeah.
The scariness, yes.
Okay. So looking back now, what did that moment that you were in the, I know like you said you were kind of just like, you know, but looking back, what did that moment teach you about your strength or your body?
I guess that you know, the body's gonna do what it wants to do, but you know, you have medication that can help you, and I just feel like, you know, my strength and my will to get over this, go through this journey and get over it. I just feel like that's what is meant to be, and that's what that is what is going to happen. So
Yeah.
that's what I, you know, truly feel. I'm getting ready, planning my surgery coming up, which will be, you know, determined, just waiting for, you know, prior authorization.
Right.
And I have to go get some, you know, do some testing to get clearance to go do the surgery. And I opted to do the lumpectomy. I hope that's the correct.
No, D. Lumpectomy.
Oh, lumpectomy. See, I always say lumpectomy. And I'm doing the right, they're taking out all three, and then on the left they're just taking out one, because I said they might as well, so I can cut down on me have to keep going to do the imaging, because they're going to say, oh, your breasts are dense, go straight to MRI. I already know the whole, you know, the whole 9 yards, and this is just cut back on, you know, a little process. And I done been to the doctors enough for 2025.
I know that's
so
right.
I said this could be, you know, I'm fine with letting them take it out. I'm asleep anyway, so
Yeah.
what difference would it really, you know, would it really make?
Yeah. Okay. I like it. I like it. I feel like, you know, this journey has just been a test, you know, for all of us. I mean, especially you first and foremost,
Yeah.
but it's been a test and it's been a wake-up call for all of us. You know, life is short, and then it's like as soon as you feel like you have a handle on things, boom, here comes something else. Because just when we like, okay, we rocking these weekly chemos, we cool, you know, we come in, and what is so crazy is that right before she said she had the symptoms, we were talking about what we were getting from Chick-fil-A.
Yes.
Okay, we just knew
We
were going to Chick-fil-A. Well, we ended up getting Burger King that night. But I mean, you know, it just, you know, there's so many lessons. It just proves, you know, you got to be flexible, because life is going to life. Like she said, the body's going to do what it's going to do. You got to be flexible, and you can't take things too seriously.
No.
Because I'm so glad I didn't have my heart set on Chick-fil-A, because I probably would have cried.
What?
Okay, because they close at 9.
What? And we didn't make it.
We did not make it. We were still sitting in the chair at 9 o'clock. Okay.
Yes.
So yeah, definitely feel like this has been a test, and we have passed, us as a family, and you know, most definitely you. My goodness. And like I told y'all before, you know, just every time I think about it, I'm like, not that I would wish cancer on anybody, or not that one person's more suitable to have cancer than another, but Tamisha, everybody is Tamisha? Really?
And they're like, really?
You know, really? That's the thing, because you could not meet a nicer, more giving, more fun-loving person, more caring, compassionate person than Tamisha. Now she will fight also, but for the most part, she is
I'm
so
much
compassionate.
much calmer. The fighting days, you know, I'm getting up there. I'm getting up there in age now, so you know the arms and the legs can't be used, so I can't be ducking, and you know I can't be doing that anymore. Only if it's really necessary.
Yeah, right. Absolutely. All right. So, what would you tell another woman who may have experienced the same type of reaction that you had? What advice would you give?
I mean, definitely. You know, I always say talk to your doctor.
Mm-hmm.
Talk to your doctor. Talk to your nurses. Ask questions if you don't know, because when you know, not knowing, that's just being ignorant. Is, you know, not knowing, and in this type of what you're going through, you need to know. If you don't know, at least have someone that's there with you that can understand and comprehend what they're saying, because a lot of times you're on so much medication, they could tell you something and you're listening, but it's like the Benadryl, you're like, you can hear, but you can feel your eyes going down and
Yeah.
you can't even control it anymore. So
Yeah.
have someone with you that's there, that fully can give their undivided attention. They could listen to everything that's going on, and that they know you and know if something is wrong. But sometimes you get, not that I was afraid to tell, and that is, it's so crazy. I don't even know why I didn't push the button. It's not like my nurses that you know that are there. It's not like they won't come and check on me. So I don't even know why did I hesitate to even press the button.
I know why.
Oh, because
let me tell. Well, no. I don't think it's that. Let me tell you something. And that this was another conversation the nurses and I had after the reaction while she was sleeping. Was that for the most part, she said chemo patients are some of the most independent patients ever, because in their head they don't want to be a burden. So I don't want to bother you with this little symptom. And like with her, I don't want to bother you that my hands are itching. I don't want to bother you that my lips are swelling up. I'll just take a Benadryl when I get home. And that's what it is, not wanting to feel like a burden. And that's who Tamisha is to her core, to begin with. So, on top of, you add that and you add that to the diagnosis, and that's just it. Like, she felt, she was just like, it's nothing, it's just a little something. I'm gonna fix it no, ma'am. No, ma'am. So that's why I believe that's why you didn't, because you felt like it was something big and you could fix it when we get home. No, ma'am. Absolutely not. Like I told them, I said, had that happened, we'd have been in the car. I would have been on 2 wheels, because at Tampa General, their ER, you have to go up a hill. I would have been on 2 wheels going up that hill. Okay. What, honey? That little traverse.
What?
Would have been tearing the road up getting back to the ER. Okay. But thank God that it didn't happen. Thank God that it happened while we were there. Thank God.
Yes.
So any advice that you want to give? Anything you want to say?
Make sure you utilize, I always say, utilize your resources. There are resources out there that you don't even know. If you feel like you're overwhelmed, they can get you resources for that. They have the support groups. I didn't use the support groups. I just didn't, I didn't, I don't, not that I don't think I'm better than the support groups or anything. I just know for me, I think by me talking and letting it out, that is my support. And my, family and friends, talking to them about it. I felt like that's my support. Me reaching, even if I just reach one person, I feel like that's, I done did that's a good thing. That's a yay,
Right.
So I feel like this is helping, but utilize them.
Yeah.
Utilize them. They can help you fill out your disability if you're gonna apply. They'll help you get other resources like financial. You need copay assistance. You need your medication paid for. They utilize it, especially if you're in the Tampa area. I'm telling you, Tampa General Hospital.
Yeah.
Hands down. When they put their commercial on the TV, they say they are like the best or one of the best. They're not telling you. They're not telling a story, and that's coming from me.
Yeah.
And I'm a real, a real person that went and see their work.
Yeah.
And what they say that they do, they
Absolutely.
do. They don't skip a beat.
Absolutely.
They do not skip a beat.
Absolutely. What's crazy is that when, because most of my associates and stuff, they are nurses. So everybody, is she going to Moffitt? I'm like, no, she's going to Tampa General. Oh, my so-and-so went to Moffitt and da-da. And I'm not saying that Moffitt doesn't give great care. I mean, I know people personally who've received cancer treatment at Moffitt, and no disrespect to them, but from what I have witnessed with my loved one with cancer treatment, honey, Marley White, Dr. Kelleher, Rebecca the nurse practitioner, Rebecca the nurse, Dr. Risk, I mean everybody, and even the Oh, geez, what's that lady's name?
Which one?
She wears the purple, but she remembers us every single time.
Oh yeah.
Starts with a B, doesn't it? Maybe.
It's two of them.
There's the two that work at the desk, and then the one in
Yes.
the purple.
The ones that always come help us.
Oh yes.
It's man.
Jeez. We're
It's
horrible with names.
it's so many because it's so many nurses and people that come just to assist
Yes.
me. Is one person accessing the port.
Yes.
Then when I go back, then I have another nurse, and then they have those that checking the vitals. The next time I record, we're gonna remember their name.
Yeah.
Because we try to look at their badge, but sometimes they're moving so quick,
and the badge spins
the
around.
badge spins around. You don't get to see their name. So next time we're gonna they're very. They always and they remember what we like too, because we always usually get. She gets a hot ginger ale. I get a water and the apples and grapes, and she'll get the bananas. And that's
remember, and the two warm blankets.
And the two warm blankets. Yeah. And she remembers like
every time,
both of them. It's like, you want the banana? Do you want the grapes and the cheese?
I'm trying to be shy, be like, yes, please.
Yes, she does. And she
But
knows.
she remembers.
She remembers. I was like, wow.
Yeah. They are truly, truly awesome. And, not saying that I am just super hard on other healthcare providers, but me being a healthcare provider myself and just the attention to detail and just the compassion and just from everybody has been awesome. Just so awesome. So I cannot recommend TGH Infusion Center or Cancer. What is it? A cancer center?
Cancer center.
Yeah, I can't recommend the TGH Cancer Center anymore. I mean, they are awesome. And I'm vouching for the TGH Cancer Center that's at the main hospital. We've never been to the infusion center at the other one, so I don't know. But the one at the main hospital, I mean, everyone is just wonderful, wonderful, wonderful.
Yes.
And we're so grateful to them. We're grateful to you for watching us and sticking with us through all these technical difficulties.
Definitely.
Yep. And even though, this part of the journey will end tomorrow, we're not going to stop recording. We're still going to keep recording. We're still going to talk about what's to come because, like she said, we got surgery. We don't know yet if we're going to have radiation. That's still up in the air, depending on after the surgery. And then there's a couple of things that will be, for lack of a better word, a game time decision when it comes to the surgery. And that's more so the lymph node removal. So, currently the plan is for 1 to 3. I know, right? That's the plan. 1 to 3 lymph nodes is the plan. But, they won't know, Dr. Kelleher won't know until she gets in there whether or not she needs to take more or whether she needs to take all of them. So, and then that one decision will determine what her post-op recovery care looks like. Yes. Whether she has a drain or whether she just, just regular and can recover. And then we got therapy. You got, and then maybe radiation, maybe. So, even though, like I said, this is the most, the biggest part of the journey, the longest part of the journey, even though this is over, we're still going to continue, coming, and Tamisha's going to continue telling her story.
Definitely.
And sharing the little tidbits that she has learned, that we have learned over these past 5 months, 5.5. It's crazy. It's crazy. Flying. It does because you think back, January, like I'm sitting here thinking, in January I couldn't even imagine us in June. No. I couldn't imagine us ready to go for round 16. Right. I couldn't. But here we are.
And we're here.
Here we are. Yes. So, definitely we're going to post a video from her ringing the bell.
Yes.
Don't talk about me if you hear me crying in the background, because I probably will cry in the background because I feel a little emotional now just thinking about it. So don't laugh at me if you hear me crying in the background, okay? But, I'm just so ready for tomorrow and ready for this phase to be over so we can get on to the next phase of healing. So, again, Mish, thank you. As always. As always, thank you for letting me share your story. And thank you guys for watching. And like I said, and being patient with us. We definitely appreciate you. And if there's anything in this episode or any of our other videos, go check them out. If there's anything that you feel someone could benefit from, send it to them. Share it. You can tag us. We're on Instagram. It's Her Health First, WC. Her Health First is all spelled out in words, WC. And we are the same on TikTok, and I'm not going to tell tales. I forget to post on TikTok a lot. I do. I can't tell you the last time I posted on TikTok because I forget, because you can't schedule it and it's just too much to remember what video and So I haven't posted on TikTok in a while, but we are on Instagram and we are on YouTube. So please reach out to us.
Yes.
Reach out to us. So that is it for us this week. And we just want to say take care of yourselves.
Yes.
And take care of each other.
Yes.
And we will see you next week.
Bye. Peace, love, and happiness.
Thanks for tuning in to Her Health First Wellness Collective. I hope today's video gave you the knowledge, inspiration, or support that you needed. If you found this helpful, please be sure to give the video a thumbs up and share it with someone who could use it too. And don't forget, subscribe and hit that bell so you never miss a new upload. Now let's keep the conversation going in the comments. Your voice matters here. Until next time, take care of yourself, take care of each other, and remember, her health comes first. See y'all soon.